All right, so Holly, welcome back. But they always say you gotta keep going until you get it right. So I just want to say thank you again for putting up with the technical difficulties and having you back on here.
Thank you
Um,
for having me.
you are the chosen one today. So before we break down everything, can you tell everyone a little bit about who you are and what you do and what you're doing now?
My name is Holly, and I am a cancer survivor. I recently was declared cancer free in December of 2025. I am currently rebuilding my life after cancer. I am preparing for a master's program. Honestly, I feel like sometimes I'm all over the place, but I am grateful to be cancer free.
That is the best news. The craziness is a good thing.
I'm
Um,
grateful for it.
Can you tell us what you had and how you found out about when you were diagnosed and like what you were going through and how old you were? And yeah,
So
we'll
the
go from
cancer that I had was called subcutaneous panniculitis-like T-cell lymphoma. Very exaggerated, drawn-out cancer name, but my oncologist initially told me that that was a rare cancer, likened to getting struck by lightning, and it was located underneath my skin, and so it presented. Initially, I could see a bulge coming from my abdomen, and I initially experienced a lot of fatigue, which later I began to have pain in my legs and I could see bruising. And those were the beginning signs of what became a cancer diagnosis. I initially did not think that those symptoms were cancer. I was 25 years old. I was active. I was a runner sometimes. And
there.
so I was thinking, okay, maybe that's delayed onset muscle soreness. I asked my sister, who was a personal trainer at the time, and she was like, "Oh yeah, you're probably just sore from that." And I'm just like, "Okay." But then when I recognized that the soreness persisted longer than 2 weeks, I knew that was not normal for a workout. My fatigue, I really thought I was just being lazy because I was taking a nap after every single shift, which was not like me. I did not even believe in naps because I felt like they were a waste of time, and I found myself sleeping a lot. And so I went to my primary care doctor with the concern about the bulge that was present on my abdomen. Um, and that was when the journey began of trying to see what was wrong. And it took me about 7 months from that time to get my diagnosis.
7 months. Why did it take so long?
So it's sad to say, I believe it took so long because typically you see a young girl that appears very healthy. She doesn't have any history of anything like this in her family. And it was chalked up to be like, oh, maybe it was a pulled muscle, or could it be a hernia, or could it be a lipoma, which is a benign tumor of fat. The doctor concluded that it might have been a lipoma, and
Now, sorry, was that through blood tests?
that was through just looking at it.
So they didn't do blood tests for the first 7 months?
I think I eventually ended up getting blood work, um, but initially just looking at the bulge that was present on my abdomen, the thought was that it could just be lipoma. And
And
maybe it was because maybe my symptoms weren't apparent enough to say, oh, yeah, this is cancer, which that's one thing that's very important to note because the symptom overlap with things. Fatigue could be anything. Maybe you're vitamin D deficient. But I think that's why it's so important that we be aware of our bodies and take notes. Just take notes in your phone when you recognize, okay, I've been dealing with this for a period of time, I've been dealing with that, and taking them to your primary care physician as soon as possible.
and because we've spoken before and we haven't, and that's like new to me. How long did it take for them to do a blood test? Because the blood test would be, I mean, wouldn't you, or at least now you should, maybe we tell people, you should always tell your doctor, I don't care what you think, give me a blood test. Like that
I
feels,
wholeheartedly agree with getting blood work done. I think that Honestly, I had a lot going on at the time. I believe in May, I turned 26. So at that point, I lost my insurance. So at the time I
Right.
was getting diagnosed with cancer, I had a lapse in my insurance. And so things had to get worked out for me to get blood tests. Um, I had absolutely a lot going on. I really did. And what had happened was my primary care physician referred me to a general surgeon who was going to remove my lipomas, quote unquote.
Mhm.
And at that time, I recognized that I started having swelling on my face. It began on one side, and then by the time that I was scheduled for that surgery, literally I had swelling on both cheeks. And the surgeon said he looked at me and he knew that that was a clinical problem and it was not a lipoma. And so I was scheduled that day for a 3-time mass excision of those lipomas. And the surgeon said that when he opened me up, it was like ill defined masses that he could see.
Wow.
And he knew that this was not what he was going in for. And that was when I received my first biopsy, which then determined that I did have cancer.
And you were 26?
I was 26 at that time, yes.
So I guess, did you have your family around at least, or were you doing all this alone?
A lot of times I went to appointments by myself, and I would think that it's because we didn't think that anything was gravely wrong. Prior to the surgery, I had scans, I had ultrasounds of my abdomen, and they could only visualize that there was inflammation present where that bulge on my abdomen was.
Hmm.
It wasn't definitive to say that this was a tumor or anything.
What did the treatment journey look like? Because now,
So I
sorry.
When I initially went to my first oncologist, I started on a treatment regimen that caused me to take about like 7 pills. They were like huge pills, and they were like vitamin A derivatives that were known to cure skin conditions. Um, but after a while, we recognized that that was not effective. It seemed to be a little bit at first, but it truly wasn't effective
Well,
for.
what were they treating for a skin condition?
So my cancer was called subcutaneous paniculitis-like T-cell lymphoma, and cutaneous entails your skin, like the cutaneous layer of your skin. And
Hmm.
so it was almost, I would say, being treated like it was a type of skin cancer.
Okay, so they still didn't really have any. And
Because of the rarity of the cancer, it was kind of like, okay, we're going to try this because it's known to treat skin cancers.
and this was after they opened you up and saw that it
Yes.
wasn't the. I don't want to say it's a false positive, but like
Yeah.
not not the tumors they originally thought were benign.
Right.
Now, did they remove those tumors when they went in the first time?
No, they couldn't remove them because it wasn't a tumor. It wasn't like something that they could just remove. The doctor said that it was like an ill-defined mass. So it
It
was
was
nothing
trapped
that could
around.
necessarily, yeah, it was just a lot of like a whole bunch of something. A whole bunch of something, and it wasn't something that you could just excise.
It's just crazy. Like, what were you thinking? Like, you went in for one thing. It's like I'm just playing in my head right now, so you'll have to give me a second because, again, you change up, you add so much more to the story each time we talk. What was going through your mind? Like, you're 26, you're like, all right, I'm gonna get them removed. My doctor says it's easy peasy, right? And then you go in, like, you wake up, and this doctor's like, I got different news for you. Like, that's mentally like challenging
I
and
was
just staying strong.
absolutely dumbfounded. I literally sat in my doctor's office, like not being able to breathe. Like, if you've ever had a lump in your throat, I had it that day. I was
And you were by
shocked.
yourself.
Yes, I was by
Even
myself.
for the cancer removal of the benign ones, you went by yourself.
I had to be brought to the hospital. My father was there. But of
Okay.
course, when you go in for a procedure like that, you don't get the results back the same day. So
Right. But that
What?
case you would.
No.
When they opened
I
you up,
went in for that excision of the lipomas, quote unquote, and they ended up using that since he had already had me open, he ended up using that for a biopsy. So they took a piece of that mass that they saw and sent it over to Michigan to have it biopsied. So it was the biopsy was tested by a large hospital organization.
right.
So I didn't have the results overnight. No.
But when you went back for them, you went by yourself.
Yes.
So we're going to make sure you're not stubborn anymore in the rest of your future. Got it. And
Yeah.
that's with love.
Honestly, I think it ended up just being a shock to all of us. We were not expecting that. I never once even suspected it.
Well, no,
Like,
I mean, your previous doctors, your general practitioner, and all told you one
yeah,
thing.
they didn't
So
expect
mentally,
that.
you're like, okay, it sucks. I have to have it removed. They'll be like, blah, blah, blah. And you go on with your life. And then
Right.
you go through this, this doctor who specializes in it. And he's like, no. And then we probably have to like jump into treatments, right? Is he the one that diagnosed this rare form yet?
So this diagnosis was, I'm sure it was a shock to both my primary care doctor and my dermatologist, who believed that a medication that I was taking contributed to me getting cancer. Um, and I believe it shocked both my dermatologist and my primary care physician. This is not a cancer that ran in my family. We had no history of this. This seemed very random, I would say. Um, and so I ended up seeing, of course, my first oncologist, and I started treatment quickly. Like, there was no delay time, there was no talk about egg preservation and fertility. Like, you're starting treatment ASAP.
Yeah. So what was that like mentally going through? 'Cause
Honestly, I my cancer journey persisted for 2.5 years. And at the beginning of it, I did not believe that that was going to be what my life was going to look like for the next 2.5 years. Because when I initially started the first line of treatment, it was
which
just
was what?
pills. It was pills called bexarotene. So there were vitamin A derivatives. Um, oh, wait, I think vitamin K or vitamin A, something like that.
But that was before you had the real diagnosis.
No, this was after my diagnosis.
Okay.
This was after the diagnosis. After I got diagnosed, I got sent to that oncologist, and I didn't believe that I was going to end up on the cancer journey this long. I thought I was going to take these pills and be done and move on with my life, and it did not happen that way at all. Because after I took that first line of treatment, we recognized it didn't work. I tried another treatment. Basically, it took me about 3 treatments until I got to the chemotherapy phase that put me in remission.
And how long did you have to go through chemo and how many
I was on
sessions?
chemo for over a year.
Oh, so lots of chemo.
Yeah, over a year.
Do you know how many sessions?
Um, it was like twice a month for a lot of time. It
Wow.
was a lot.
It was like
It's a
20.
lot. It's so much to think about. It's so much to recount because there were days where I said, I'm not going. There were days I just cried and I was full of anxiety and I would anticipate the after effects of the chemotherapy. It was absolutely a lot. I would call my provider and be like, I can't do this today. I can't do this today because
Your
my
provider,
chemotherapy.
you mean the hospital?
Yes, I would call my the doctor's nurse practitioner.
Okay, nurse. Okay, I thought
Typically
you
you don't just speak with the doctor directly.
were. Yeah.
So I would call them up like, I'm not going. I can't bear this today mentally, physically.
And did you go with some family during the treatments, at least too, or you just went by yourself always?
Sometimes my dad took me. Sometimes my friends would go with me.
Oh,
There were many days I would get dropped off. And a lot of times during my life going through cancer, I always felt like I didn't want to burden anyone else with what I had going on. Because I understood that people had a life. My dad had a life, my family had a life. And I felt like, well, just drop me off and pick me up when it's over. Because I couldn't necessarily drive afterward. I would feel so sick.
Yeah. I mean, it's a very powerful drug. I mean, that medicine is no joke. And it takes years for your body to like fully recover. So let me ask you a question, and I don't know if this, I honestly, I hope I'm not confusing it, but you went through stem cells too, or no?
Yes.
You did. Was that the first, like after chemo, like what happened that led them down the road to like stem cells?
The
Or do
stem
you
cell
want,
transplant was the final step.
were there other steps before that?
Yes.
So let's talk about those.
So chemotherapy comes before a stem cell transplant. So I was on chemotherapy for over a year, and the requirement of a stem cell transplant is to be in remission, or at least you can't have a full body full of cancer for a stem cell transplant. I had to be in remission as a prerequisite for my stem cell transplant, um, because the stem cell transplant is a complete immune system wipeout. It was a very serious, very serious venture. Um,
Like,
and
what did
so
you do? Because I know that there's a lot of prep. Like, you have to like isolate in a hospital for like almost a month, right? Because they take,
I was in the hospital for 23 days.
and you're basically isolated, right?
For the
You're
most part, yes.
you can't be around anyone really.
For the most part, my family was able to come over, but of course we had to take, strict precaution. No one could be sick at all. Um, it was a very big deal, a lot of deconditioning. I know I lost a lot of weight. There came a time where I couldn't eat. I ended up on TPN, so I was being fed through like liquid through an
You know,
IV.
do that.
It was it was an amazing experience in many ways. And I'm thankful
Explain
for it
that.
because my baby sister ended up being my donor match for my transplant.
Aw,
I literally have blood DNA of my baby sister.
I'm sure she'll use that as a hey, keep alive,
Yeah,
like a little sister should, right?
I'm so thankful for her because she didn't have to go through that for me. And just her being 100% match, which increases the effects of transplant. If your donor is 100% match, that increases the efficacy of their stem cells in your body.
Oh wow,
Hmm.
I guess that would make sense because it probably doesn't get as rejected, right? They probably
Yes,
tell you
yes,
your
because
body has to fight so
everyone
much.
who undergoes a stem cell transplant is at risk for something called graft versus host disease, which
Yes,
means your body is like, whoa, 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 what's that? And then it'll start rejecting it. But
and
thankfully, I
did you
haven't
have
had any
any
signs of that.
no autoimmune problems after?
No. Sometimes I marvel at the fact that I'm doing so well, that I am recovering so well. I'm recovering so quickly. I thank God. I really do. Because a lot of
That's
people end up having the graft versus host disease and end up with chronic, back in the hospital, and just, I could not imagine having to be back in the hospital. I can't.
yeah. Finding a lot of stem cells have a lot of it's as amazing as it is. It's still so new that
Yes.
like we interviewed someone recently that saved his life, stem cells, but now he has the chronic graphers. Um,
Graft versus host disease, yeah.
yeah, that word. And he's always in the hospital. But it's better to have an autoimmune disease than die of cancer. So
It's a
apparently, you don't
lot.
think so.
It's so much. And I feel like a lot of the things that we tend to deal with after cancer are attributed to having cancer. You know what I
Well,
mean?
it's from the chemo
Right.
that
Like,
takes out the
for
body.
example, my lack of fertility at this point, the ability to have children, like, that's because of the transplant. So it's a lot of stuff that can result, or like, you know,
That's because of the transplant or because of the chemo?
because of the chemo having the chemo that was necessary for transplant. That was a
Okay.
whole separate chemo from the chemo that I was on for a year.
Yeah.
That was high dose chemo, so that's the one that completely can obliterate your ovaries, all your eggs, and everything.
Well, I mean, it basically sets your body at zero,
Pretty much.
which is scary, but
Pretty
it's
much.
that's the part that they'll have to still work on in medicine.
Pretty
Um,
much.
but you're doing great now, so that's
Yes.
you gotta shine the light on that. What do you think was a contributor to you being so strong during this?
The Lord.
All right.
I attribute everything to God. My health, my strength, the fact that I came out not looking like really anything happened to me. Of course, I see the differences that my body made through going through cancer, but people would not know. When they look at me and they see the strength that I have, I'm like, God, it was nothing but your mercy. You know,
You know what they say? God is good.
He's so good.
Were you faithful before this?
Yes.
Okay.
And I believe that's what helped me through my cancer journey. My the foundation that I already had in God is what
Okay.
carried me through my cancer journey, because otherwise I would not have made it. I would have lost my mind.
So, how do you think this experience has changed you in your life today?
Honestly, I was literally thinking this morning, I'm always thinking about how it's so weird to say this, but cancer is the best and the worst thing that ever happened to me.
The gift and the
It
curse, right?
absolutely is. Because it made me stronger. It's caused me to inspire so many other people. It's given me vision that I never thought I would have. It's given me a new life, a new outlook on life, another chance at life. And though I experience pain, now I can relate to others with the pain that I've experienced. Now I can help somebody else and actually understand what it's like to be in their shoes. It's easy for people to say, "Oh my God," people can always say something, but it's like you don't understand this,
Yeah.
you know, and that's okay. Everybody's not meant to understand cancer, but I'm glad that I am in the position that mentally and physically I can inspire other cancer survivors.
I like that. And it gives you find your purpose through the pain, and now you have a passion.
Definitely.
So that's you gotta always look. I always tell people you gotta find the purpose in the pain, or else none of it's worth it. The second you have that
Right.
passion and that purpose, everything will make sense, and your future will be different, and you're a better human because now
Yeah.
you can see things objectively without being so negative. Because we're taught to be negative, I think, just with society. So it's a beautiful thing when you're here, when you're kicking butt, and we love that. I guess like during treatment, what helped you to keep busiest and like just in case anyone's listening because they're sitting in that chair right now and they're like, "Oh, I gotta sit through this for another 6 months." Were there tricks or to the trade that you like kept yourself busy to like not realize that you were like hooked up for hours at a time?
Honestly, my best thing to do during treatment was sleep.
Oh, you were
I
able to sleep.
I never colored in a coloring book. Never, not once.
Okay.
Um, because I had to sit through treatment for 5 hours.
Wow.
5 grueling hours. Oh my goodness. Like sometimes I would ask my provider, I'm like, can I get my treatment cut down to 2 hours? Because this is insane. This is absolutely insane. But before every treatment, you get pre-medications, and so some of those pre-medications, like the steroids, dexamethasone, and things like that, cause you to get drowsy. And so, to me, that was the best thing because I want to go to sleep and wake up when this is over. I don't want to experience all of this stuff going through my body. I brought my little handy blanket with me, and I went to sleep.
Ah, listen, that's a blessing. So if you're listening, go to sleep.
Go to sleep. Just go to
Not during
sleep.
the podcast. So And I hope that we can just jump in this, but you can give a backstory. Because I know that when we first started speaking, we, I, um, found out that you were doing Chosen, which is your passion for having a clothing line to help inspire people while they're going through treatment. And we were hopefully helpful in giving you some business advice and creative and and again, we will always be here. If you need anything, always call. But like, how's that going? And what have been like new highlights of it, if there are, or just break it down for the audience.
So, in
But
the midst of my cancer journey, I was inspired to know that I was chosen to defeat cancer. And so, the funny thing is that I had designed this shirt like way years back. I definitely believe that this brand was used as an inspiration for me in the midst of my cancer journey on the hardest days. To know that I was chosen, to know that I was chosen for something, to know that I was chosen beyond my diagnosis, to know that I was chosen for something greater. Um, and then I began to use this brand to inspire others to know that they too were chosen. You didn't get cancer by accident. You are chosen. And I think that it was so important to own this, it helped my mindset throughout the journey. Yes, I had my times where I was defeated, I was weary, I was sick and tired, I didn't want to do it anymore. But this gave my journey meaning. Um, and I began to use my brand to give others meaning. When I would see patients at the hospital looking down, I would give them a chosen shirt. When people would inquire about what that was, I would send them a chosen shirt, like, you are chosen to defeat cancer. And I feel like it really inspired so many people. And that in turn inspired me and blessed me to know that I could inspire someone else and give someone else that encouragement in the midst of going through something so hard. Um, and we're working on a lot of things right now because another thing that I recognized was that Chosen wasn't only for cancer survivors, but Chosen is truly for anyone to be empowered. I had a friend that was in a terrible car accident who suffered a traumatic brain injury. And I'm like, wow, this girl is chosen. She is
yep.
chosen. She went from being asleep for days in the ICU, many, many days in the ICU, went to rehab for the past year. She was not talking for over 200 days. She didn't speak a word.
Oh
And
wow.
I'm like, this girl is chosen. And so chosen has become a movement. It's become an identity. You are chosen. Find what you're chosen for. And so we got some things coming in the future. I have a lot to work on. So sometimes I've kind of like let chosen rest a little bit so I could work on bigger things that are taking more of my effort and time right now. But um, chosen forever.
I love that. Well, if I can suggest, you should always just keep it alive. And again, I know you're going to hate me for saying this, but you should keep it alive and keep it as simple as possible with just having a message of whatever you're going through, you were chosen. You could take away all the other, you don't have to label everything right now, and you don't
Right.
need 25 different slogans.
Right.
Just keep it going. Just you can wear a t-shirt every day. You can take one photo or a 32-second clip every day and just post something, which takes not even a minute of your life a day to at least get the message going, to find its algorithms, and to find your community, because you don't want to keep going up and down. And if you're busy with 900 other things, and it sounds like with your master pro and all that, and you should be, that's obviously 1,000% more purposeful in life. But if you want that and you want to be chosen to choose to help others, keep it going on the back end. You don't have to worry about it 365 days a year, but you could post one photo a day. And that's all I would suggest, just so that you don't lose interest. And it also keeps it in the front mind of yourself, but also on social media and for other cancer kids or patients.
I
And
agree.
just You agree a lot with me, and then you don't listen. I feel like you're my child at this point.
Oh my god.
Tell me I'm wrong. But it's all out of love. And I want to see you thrive at this because I think that's always a powerful thing to come out of this with the purpose. And you're going into something. What are you studying to be again? I want to say nurse, but it's not a nurse. It's
So I am preparing for physician assistant school, and it's amazing because my cancer journey clarified my goals as it pertains to becoming a physician assistant. I initially didn't know what I wanted to specialize in, and I really want to specialize in oncology. When I walk through the hospital, I promise you, I look at patients and I'm like, oh my God, I will be treating them one day. I will be managing their care one day. I will be an advocate for people that were in the same shoes as I was in.
it's a beautiful thing. You found greater value out of a very dark situation, and you can only be commended for that. So I hope you know that that inspires others.
Thank you.
Let me ask you, what would be your message or advice that you can give someone that's just been diagnosed with cancer?
For somebody that was diagnosed with cancer today, I would be honest with them and tell them it is going to be hard. There will be ups and downs. There will be pain, even with your family members and friends sometimes, when you feel like, why didn't they show up when you thought they would, or all of these things. You will have your low days. There will be an expiration date to all of it. And I think that's the hope. There's an expiration date to every single trial. Like, pain is not forever. Troubles and struggles are not forever. Because when I look at myself now, it's May 25th. Wow. May is the month that I got diagnosed with cancer in 2023. And it's
Wow.
like, I didn't even recognize that day as this month came on. So it's like, you don't remember the pain after you've already gone past it. It's like I can recall the things that I experienced. I can recall throwing up and bleeding and all the crazy things that I endured during transplant, during chemo, not being able to eat. Like, I can recall all of that, but I no longer live in that. And I don't fear my future of, oh my God, the cancer's going to come back. I am moving on and I am living my life that has been granted to me as a cancer survivor. So don't give up.
I like that. Trying to think of the right words because every time I speak with you, I feel like I learn more about you, which is beautiful, but I also see how strong you are and how life keeps giving you these strength tests and you're just surpassing them. And I think that's a beautiful thing. I think it's an inspiring thing. And I'm so honored that you would share your story with us and our community and have chosen this platform to speak up and speak out. So I thank you for trusting us. I thank you for your honesty. And I hope that we can continue hearing more great things about you in the future. And I definitely want to see the fashion brand come to life over the next year. So we are here for you. But I thank you for coming. It's seriously such a pleasure having you. Thank you.
Thank you so much. Thank you so much for having me. I appreciate your platform as well. I love anything that pertains to advocacy and patient support and encouragement. I feel like it's so, so necessary and so, so needed because it's easy to feel isolated in the midst of our cancer journey. So I appreciate you.
Thank you. So this is what we like to just have rapid fire. Are you ready?
Yeah.
Okay. Favorite food?
Salmon.
Prepared a special way?
Steamed.
That is boring.
Oh my God.
That's your favorite food. I
Yep.
You just threw me for a loop because that is not like steamed
Well,
salmon is not a
it
favorite
used to
food.
be pizza, but I matured.
That is Pizza is a good answer.
Wait, hold on. I think my wig is sliding back.
You ever watch the interview where the woman fell and her wig fell off and she's
When
like,
your life does not, oh my God. Oh my God.
okay, well you threw me for the do you I'm just gonna ask a moment. Did you lose your hair from chemo, or do you just keep it bald now?
Did I lose my hair?
From chemo, or do you have hair also? I don't know if you're bald or not anymore. I didn't know you had a wig. That's a great wig. I know
Oh
I've seen
my god.
bald. You have a great head
No,
bald.
no,
I know
I did lose my hair actually, but it started growing back, and then it started falling out again. So I kind of cried about that, and then I'm just like, well, just use the wig for now. Let's see what happens.
listen, it's a great wig.
Thanks. I hope to get more.
Different colors, different styles. Yeah, no, that's the picture I was seeing. It's great. It's you have a great bald head. It's not fair. I'm a little jealous.
Thanks. But then we put the wigs on for later.
Yeah,
So yeah.
it is a great wig, like shockingly great.
Yeah.
That you should probably
We
tell
just
people
have to know how to put them on, like, because if I put this on crazy, you can tell it's a wig, honestly.
like
So
sideways. No, I'm just kidding.
yeah, sideways and back there is just yeah.
Do you have a favorite game?
No.
Okay, you're making this very hard.
If I could be an athlete, I would play tennis.
You would play. Okay, love tennis. I was a tennis kid, so good
Love
pick.
it, love it, love it, love
Um,
it.
favorite movie?
I like Idris Elba.
Who?
Idris Elba.
I don't know what that is. Um, favorite music?
Christian.
Of course. Do you sing?
Yes.
Are you in the choir?
Yes.
Well, let's hear a little.
Love you, Lord, for your mercy never fails me. All my days have been held in your hand. From the moment that I wake up until I lay my head, I will sing of the goodness of God.
Well,